Hello, my name is Amanda Harris. I'm a student at Parkland College. Today I'm going to do a competency video on administering a dry powder inhaler, Ellipta, as the medication. First thing you want to do is review the patient's charts and go over the doctor's orders. Always perform proper hand hygiene. Hello, my name is Amanda. I'm a respiratory therapy student. How are you today? Okay. Would you please verify your name and date of birth? All right, thank you. Okay, I'm going to get your pulse and your respiratory rate. So how you do that is you feel for the pulse for 15 seconds and multiply that by 4. And then when you're looking at their chest, watch it rise and fall for 15 seconds and multiply that number by 4. Next, you want to move on to listening to their breath sounds. How you would do that is 3 in the front, 4 in the back. Go from top to bottom and left to right. All right, Mr. Wilson. Should take some deep breaths for me. Sounding good? All right, sit up for me a little. Thank you. Getting some deep breaths. Okay, thank you. You are a little wheezy in there, aren't you? All right, you remember how to do the huff cough? You just kind of get everything flowing and get some out. Okay. What you do is just whatever you can get out, you just get out and spit for me. Okay, thank you. All right, next thing I want to do is we're going to take your peak flow. Do you remember how to do that? It's the one where you breathe in real good and blow out real forcefully. You do? Okay. We're going to put the mouthpiece on. Again, I want you to exhale, taking a nice deep breath and blow forcefully into this. Wrap your lips around this real good. Okay, thank you. All right, so after you get done assessing the patient, you also at this time while you're doing this, you want to watch for their work of breathing and check their skin color. Make sure it's not bluish in appearance. Okay, so the doctor has prescribed a dry powder inhaler. This one is Ellipta, okay? You take this once a day. It's breath activated. I want to make sure that you understand that this is not a fast-acting inhaler. This is not going to help you if you are having an asthma attack. No way. So you must use your albuterol, not this one. Remember, it's dry powder inhaler. Okay, it's not going to help you. Okay, so now that I know you know that, the next important steps is this has a counter. As you see right here, it starts out with 30 doses. There's no need to prime this or anything. The closest thing to priming is when you open this, watch that the numbers go down. See, okay. And when that number goes down and it clicks, your medicine is ready to go. Now, when this gets down to 9, it's going to turn red. And at this time, I want you to contact your physician and make sure that you have another prescription at the pharmacy for you. You don't want to run out. Another important thing, when you're using this, do not block those vents with your fingers because it's going to mess up how you get it. Okay, so you're going to hold it exactly like this. And it's almost like with the peak flow. You're just going to blow out and then be ready to take a nice deep, you want to suck that medicine out of there. It's breath activated. So you got it clicked, you watch the number go down, you know the medication's loaded. Wrap your lips around this and suck it in, okay? Now you are not going to taste anything, you're not going to feel anything, but if that number went down, then it's working, okay? And you just close it up. You want to make sure you hold the medication for 10 seconds or as long as you can. That gives it time to get in your lungs. Okay? Now what I want you to do is show me from beginning to end. That way I know you know how to do it. Okay, so after the patient shows you that they know what to do and repeats everything as far as the dose, the time of day, and all that, you want to reassess them. So again, you would get their pulse rate, you'd watch their respiratory rate, you'd listen to their breath sounds, and you would do the peak flow. Okay? And then you take your gloves off and perform proper hand hygiene again before you leave the room.